Arsenic is a naturally occurring element in the crust of the earth and is extremely harmful to people. In the Middle Ages and Renaissance, arsenic murder became a popular technique. Arsenic poisoning frequently went unnoticed since the symptoms are similar to those of cholera, which was widespread at the time. Arsenic also was used as in cases of domestic abuse. Placing arsenic in his coffee was a widespread method of killing or poisoning a person. Arsenic is a poisonous metalloid element with almost little taste or odor, making it challenging to detect through taste. Doses under 5 mg results in nausea, vomiting, diarrhea, and abdominal pain. Symptoms start to appear minutes to hours after ingestion and usually go away within 12 hours. But sometimes, symptoms may persist for days after exposure. Diarrhea is typically described as rice water or cholera-like diarrhea, which may be bloody. Hypertension, which results from dehydration and volume loss, is another defining feature of arsenic poisoning. Cough, dyspnea, chest pain may be seen, more commonly with inhalation. Numbness and tingling of the extremities and muscle cramping can also develop. The lethal dosage of inorganic arsenic are 0.6 mg per kilogram. Death occurs 1 to 4 days after ingestion. The exact mechanism of arsenic in the body is not known, but it inhibits the formation of acetyl-CoA, also the enzyme succinic dehydrogenase. Arsenate can replace phosphate in many reactions. It acts by changing the functioning of around 200 enzymes. Diagnosis is by testing the urine, blood, or hair. The most common reason for long-term exposure is contaminated drinking water. Long-term health effects include the first symptoms: skin color change, skin lesions, and hard patches on palms and soles. Feet hyperkeratosis. Arsenic is carcinogenic to humans, which means it can cause cancers. Other long-term effects include diabetes, pulmonary disease, cardiovascular disease, and myocardial infarction. Arsenic has a negative impact on a child's cognitive development. Source of arsenic. Nowadays, groundwater is the main source of arsenic poisoning in many countries, including Argentina, Chile, China, India, the United States, and Vietnam. The areas most affected are Bangladesh and West Bengal. In seafood, arsenic can be presented in a less toxic form. Arsenic is a byproduct in smelting processes for many ores including gold, lead, cobalt, nickel, and zinc. The main prevention is to use clean water, without being contaminated with arsenic. Do not use groundwater, but use rainwater instead. Install arsenic removal systems, either centralized or domestic. Treatment. Dimercaprol and dimercaptosuccinic acid are chelating agents used for the treatment of arsenic poisoning. The most important side effect of this medication is hypertension. Chelation therapy has been shown to improve outcomes if started in minutes to hours after arsenic exposure. Supplemental potassium decreases the risk of experiencing a life-threatening heart rhythm problem from arsenic trioxide. The prognosis is highly dependent on ingested arsenic state, amount, and duration of exposure.